Welcome. In this video, we'll be exploring rheumatic heart disease, a serious condition affecting the heart valves and a long-term consequence of rheumatic fever. We'll delve into its causes, how it impacts the heart, its telltale signs, how it's diagnosed and treated, and importantly, how it can be prevented. Rheumatic heart disease begins with rheumatic fever. This is an inflammatory disease caused by an autoimmune reaction to a group of Streptococcus bacterial infection, such as strep throat or scarlet fever. If these infections aren't treated promptly and effectively with antibiotics, the body's immune system can mistakenly attack its own tissues, particularly the hearts, brain, and skin. This autoimmune response is what sets the stage for rheumatic heart disease. The pathophysiology of rheumatic heart disease is complex. The inflammation triggered by rheumatic fever damages the heart valves, most commonly the mitral and aortic valves. This inflammation leads to scarring and thickening of the valve leaflets. Over time, this scarring can result in two primary problems: valve stenosis, where the valve doesn't open fully, obstructing blood flow, and valve regurgitation, where the valve doesn't close properly, causing blood to leak backward. These valve abnormalities force the heart to work harder to pump blood, eventually leading to heart failure. Rheumatic heart disease is most prevalent in developing countries where access to prompt antibiotic treatment for strep throat is limited. While rates have declined in developed nations, it remains a significant health concern in underserved populations globally. Children and adolescents are particularly vulnerable to contracting rheumatic fever, which can then develop into rheumatic heart disease later in life. Understanding the global distribution of this disease is crucial for effective prevention and treatment strategies. The signs and symptoms of rheumatic heart disease vary depending on the severity of the valve damage. Common symptoms include shortness of breath, especially during exertion or when lying down, fatigue, chest pain, palpitations, swelling in the ankles and feet, and dizziness or fainting. In severe cases, symptoms of heart failure, such as persistent coughing or wheezing, may develop. It's important to remember that symptoms can be subtle in the early stages, so early detection is key. Diagnosing rheumatic heart disease typically involves a combination of a thorough medical history, a physical examination, and diagnostic tests. The doctor will listen for heart murmurs, which are abnormal sounds caused by turbulent blood flow through the damaged valves. An electrocardiogram, or ECG, can detect abnormal heart rhythms. An echocardiogram, which uses ultrasound waves to create images of the heart, is essential for visualizing the heart valves and assessing their function. Additional tests, such as chest, rays, and cardiac MRIs, may be used to evaluate the extent of heart damage. Rheumatic heart disease can manifest in different forms depending on which valves are affected and the type of damage present. Mitral stenosis is the narrowing of the mitral valve, while mitral regurgitation is the backflow of blood through the mitral valve. Similarly, aortic stenosis is the narrowing of the aortic valve, and aortic regurgitation is the backflow of blood through the aortic valve. Patients may have a single valve affected or a combination of valve abnormalities. Treatment for rheumatic heart disease aims to manage symptoms, prevent complications, and improve the patient's quality of life. Medical management includes medications like diuretics to reduce fluid retention, ACE inhibitors or ARBs to lower blood pressure, and beta blockers to control heart rate. Anticoagulants such as warfarin may be prescribed to prevent blood clots if atrial fibrillation is present. In severe cases, valve repair or valve replacement surgery may be necessary. Valve repair is preferred when possible, but valve replacement with either a mechanical or bioprosthetic valve may be required. Regular follow-up with a cardiologist is essential to monitor the disease's progression and adjust treatment as needed. Prevention is the most effective strategy against rheumatic heart disease. Prompt diagnosis and treatment of strep throat with antibiotics, usually penicillin or amoxicillin, is crucial. Public health initiatives focused on improving sanitation, hygiene, and access to healthcare in high-risk areas are also essential. Secondary prophylaxis, which involves long-term antibiotic treatment in individuals who have already had rheumatic fever, helps to prevent recurrent infections and further damage to the heart valves. The prognosis for rheumatic heart disease varies depending on the severity of the valve damage and the effectiveness of treatment. With proper medical management and, when necessary, surgical intervention, many patients can live relatively normal lives. However, rheumatic heart disease is a chronic condition that requires ongoing monitoring and care. Recent research is focused on developing more sensitive diagnostic tools for early detection, exploring new medications to reduce inflammation and prevent valve damage, and investigating less invasive surgical techniques for valve repair and replacement. These advancements offer hope for improved outcomes for individuals living with rheumatic heart disease.